Okay, so you had an athlete come in with ankle pain. You got to first talk about what sport they did or they play, what position, how old are they. Once when you figure that out, you want to find the mechanism of injury. You know, was it eversion, inversion, hyperdorsiflexion, plantar flexion, the twisting motion, did someone fall onto it, were they running when it happened, and stuff like that. And you also want to find out the chief complaint. Where does it hurt? What kind of pain? Sharp, dull. Is it shooting pain? Is it a burning sensation? And ask them on a scale of 1 to 10, 10 being the highest, what their pain is like. You want to ask when did it happen, the time, where. Ask them if they had started to do any new type of physical activities. Are they running more? Have they been jumping more? Have they been training more? What surface did they injure? Was it turf? Was it grass? Was it, on hardwood or whatever, or on a basketball court? You want to find out if they've taken any actions for their injury. Have they taken any medication? Have they done any stretching, rehab? Have they seen any other physicians or anyone about the injury? And the last thing you want to figure out is, have they injured this ankle before, and was it a similar injury, or is this an ongoing thing, or is it similar to an injury they've had in the past, and like that. So once when you get a good history down, you're going to observe and look for swelling, deformities, ecchymosis. You want to observe not only the foot but up the leg, see if there's any swelling or pain or discomfort up there. And you want to palpate some landmarks like both malleoluses, your tarsals, navicular tubercle, sinus tarsi, tibia and fibula. Go palpate up the shaft, all the muscles, your gastric, your soleus, your tibialis anterior, perineals, and all the extensors and flexors. And once when you observe and palpate, then you can move on to your special testing. First one is the anterior drawer. You're going to put their foot to neutral, a little dorsiflex. You want to stabilize with your with one hand, stabilize the leg, with the other grab the talus and the calcaneus. Use your arm to push up, so like that. You're going to pull the talus anteriorly, and you're looking for any laxity or pain there. And if they do have laxity or pain, that's a ATF, anterior talofibular ligament. That's usually is what the implications are with that special test. They grade a sprain to that ligament. You can also then do your eversion and inversion. With inversion, this is your talocalcaneal ligament, and with eversion, it's your deltoid ligaments. And also, you can do Kleiger's test, in which you want to grab the foot, stabilize the legs. And you're going to do an evert or an external rotation with the foot. When you do this, if you're in dorsiflexion, you're testing the syndesmosis up here in the high ankle, and with neutral or a little bit of plantar flexion, it tests more of the deltoid ligaments. If you're suspecting a fracture in the distal part of the tibia or fibula, you can do the squeeze test, which you start away from the injury site, and you press on the tibia and fibula and slowly go down to the injury site until pain occurs, and that's an indication of a gross or stress fracture. And another test for the fracture is the bump test, where you put the foot in dorsiflexion, and with the palm of your hand you're going to hit up on the calcaneus, and if they have pain, wherever the pain is usually where the stress fracture is. It could be the calcaneus, could be the talus, could be the tibia or the fibula. The drawer. The last test I'm going to do is, can you flip over real quick? Try to at least. That's good. So you want to make sure they're relaxed. This is testing for an Achilles rupture. When you press and squeeze the belly of the calf, you're looking for the foot to go plantar flexion, which, as you can see, his foot does plantar flex. If the foot did not plantar flex, that would indicate an Achilles rupture. And those are some special tests for the ankle and foot. Thank you.